All right, we're going to go ahead and get started. And again, last time, thank you so much for joining. If we have anybody else join, awesome. Again, this is just a quick webinar. We just wanted to go over some points that a lot of practices aren't aware of, why it's actually really beneficial to send your data to DHIN. So again, this is something won't take much. I only have a few slides to go over. And at the end, hopefully we can open it up for discussion, just to go over if you have any questions or concerns or want to get further information. So we'll go ahead and get started. So becoming a DHIN data center. Why should my practice become a DHIN data center? A couple more fine points is really three main reasons. One, to increase your reach. So every year, Delaware practices depend on us, DHIN, to deliver over 18 million results every year to other practices. Practices also prefer when they can actually order results from facilities that offer electronic delivery, opposed to fax, mailing, courier, etc. And we've seen this in our interactions as business relationship managers in the field. Especially with HIPAA concerns and things, they kind of want everybody to step away from using the fax. They much prefer electronic delivery, such as results delivery through DHIN or an HIE, or using things like direct secure messaging. So also results sent to DHIN from our data centers, they're always available for anybody who subscribes to the DHIN network to get access to for reference through the DHIN community health record. It's always there from the future. You can even go in right now into the community health record and look up results that are there from 2007 when we first started. So you can always build a patient history, no problem. And if you're actually contributing your practice, putting results in there, that saves you a lot of time on the back end for having to deal with getting those results out to people that are ordering it from you. So again, we have one of our quotes from one of our data centers. Practices using us for their imaging needs know that they will have their results sent to them as soon as they are completed. That convenience makes them keep recommending us for their patient needs. And we've seen that in the field. The second big reason, it increases your productivity for your practice. So sending your results to DHIN means that your practice does not have to worry about delivering results to the ordering or copied providers. And DHIN's technology team, our NetOps and service desk, will work with you to build a connection to your system. And then once that connection is actually established, your results are automatically sent to DHIN and then routed right to the appropriate providers, and they're automatically available in the community health record. So they're always there for future results, and you never have to have a staff member who's dedicated to getting those results out. So that does save, time and money. And as we can see, we kind of go into that in more detail on the next slide. The third big reason is to improve the workflow of your practice. Excuse me, sorry, I'm losing my voice a little bit. Results sent to DHIN are always available for future retrieval by all DHIN subscribers through the community health record. And we handle results delivery for data center sending organizations and make the results available through the community health record. And because of this, organizations that send data to us are able to operate more efficiently by reducing manual tasks such as sending results by fax, email, or courier. And there's tons of articles out there you can read about this. It's a big trend growing now in the medical community, is that it can save you hours of high salary employees' workloads every week and increase a competitive advantage for your practice. So what does this mean? Lots of specialty practices out there like cardiology, endocrinology, pulmonary. They're all doing a lot of in-house stuff, and not many of them are getting those results to the community health record. So if you're a specialty place and you've had a patient assigned to you from a primary care provider, you have to get those results back to that primary care provider. And like I said, if you're a cardiologist, say, for example, you're doing tons of these tests every day, and then somebody is having to get those results together and deliver them manually to that practice. And then there's also no future reference that somebody can just look back on to get the history automatically. If they want to pin that, oh, well, they've been to Delaware Cardiovascular Associates, for example, they're going to have to contact you over the phone or email, and then your staff member has to go and hunt up those results and deliver it to them. That costs time and money throughout your day, paying somebody to just do that. Where if you're with DHIN as a data center, those results get delivered automatically to the copying physicians that you want to have on, or if somebody's ordered the labs or tests directly, but also it's there for future reference, so they can just look it up manually as well, and it's always there. So for example, what kind of data can I send? Here's some common in-house labs that we already work with and we're fully compatible. And a lot of these are done at regular family care practices and such. So you can see here, spirometry, lung function tests, electrocardiogram heart screenings, echocardiography screenings. Big time in cardiology is exercise tolerance testing, hearing and vision screenings, which are done in a lot of family care practices, hemoglobin A1C diabetes screenings, lipids testing, H. pylori testing, mono tests, pregnancy tests, strep and flu tests, and there's tons of other testing and screening types that we can take into the community health record and take care of the delivery for you. The other option, if you're not doing these kinds of things, but you still want to contribute to the community health record, is by sending continuity of care documents, CCDs. These are really important. So continuity of care documents give clinicians a standard way to share a comprehensive yet concise representation of a patient's medical history and current condition. This is really important. We're trying to get a lot of just even everyday practices involved in sending these because it helps you build the patient history so that you can just go into the CHR, look up in your patient summary on the community health record, and you can see, here's a continuity of care document that was done, say, last month, and you'll be able to see what their vital signs were at that time, what medications they were on at that time, family history, encounters, all these things that can be included in the CCD are right there. It's the kind of thing that by you contributing this, it kind of goes to the overall good that it's something that you would want to be able to gather yourself for your patients. So if we can get everybody on board just contributing this data is incredibly useful. And if everybody kind of chips in and does the CCD, sending CCDs to the community health record, it will help vastly patient care in our community. So why should your practice send CCDs to DHIN? Providing these standard data types to the community health record helps to improve patient and clinician experience in our community. It does also lower the cost and promotes better outcomes. That way you can see if there was certain tests that were already run, maybe locally, because we can have some little minor things on there, such as if they did have a flu or a strep test done in the practice at that time, that can show up on a CCD. Contributing data to the DHIN community health record also helps your practice meet the HITECH Act meaningful use goals for your practice. And if you do commit to sending CCD data to DHIN, you will get a $200 discount on that annual fee for DHIN of $500. So you're only paying $300 instead of the $500. So if you want to send data to us, the next step, if you're interested in hearing more, we have three really amazing, good business relationship managers and myself. We are here to answer your questions and walk you through any steps or concerns if you want to see how to maybe move forward, or if there's an obstacle you think you have, we can discuss it with you, set up a call, work through whatever questions you may have. These are our reps. You can see the areas that they work. Please feel free to write down who your representative is for your geographic location, and please reach out and contact them. We definitely want to hear from you. I'll also be having the attendee list for today shared with these representatives so they can also reach out to you as well for follow-up. So please, that is all we have for right now. If there's any questions or concerns, I'm going to go ahead and open up the room so that everybody can speak. And then I would love to hear some questions, concerns, anything you have. So please feel free, just raise your hand and I can unmute you. Go ahead, Dana.
Hey, Tyler, are you here? Tyler's here, right, Garrett?
Yes.
Okay. Yeah, so Tyler, right now, like now would be a good time if, you had any questions, especially as far as like what the next steps would be for Miraki to become a data sender. Garrett is very well versed in in this area. So I just wanted to let you know, if you had any questions, let them or fire them off.
Can you hear me okay?
Yep.
Wonderful.
Yes,
So I think really at this time for us, we don't have too many questions. When it comes to sending our data, I think we're looking at sending like just ADTs. Is that possible as well?
yes.
We
Yes,
don't really do any in-house labs or anything like that. Okay.
that's fine. Yep. ADTs are very helpful. And that also works with when you're sending ADTs, that helps work as well hand in hand, because most of our practices are signed up for what they call event notification service. So then when they have a patient roster that they give us, they're notified then based off ADT information that we get, whether or not their patient has been checked in or out of the facility, so that they can do follow-up. So that's great. I mean, that's excellent. And just to show as well on the screen, I also have the pricing implementation for becoming a standard data center. This is not for CCD. This is for if you're actually going to send labs. And it goes by volume, basically, is what it is. So still, even on low-end areas, if you can see the screen, sending up to 150,000 results a year still only ends up in long-term becoming a yearly cost of $2,500 a year, which is definitely going to be way less than what a lot of these places are paying somebody to send the results and look up the information and get them out to the practices that are requesting them. So it is a big savings in your workflow. And yeah. Any other questions or concerns? All right. Well, if that's it, I'm going to go ahead and close up the webinar. I really appreciate you joining. This has been recorded, so we're also going to have it for future reference, but we plan on maybe doing one of these every month. So if you have anybody interested as well who maybe missed this one, please be on the lookout in your email. We will be having these on the regular, hopefully to reach a large audience. So thank you again. I really appreciate you joining. And I hope to talk to you soon, and we'll have your business relationship managers reach out to you shortly. Thank you so much.